Hi, this is an explanation of how to use authorizations through the Special Medical Guidance Program and our MBM Now tool for processing authorizations for Blue Cross Blue Shield South Carolina for specialty drugs on the medical benefit, including cancer drugs and also specialty non-cancer drugs. My name is Tim Foley. I'm one of the product leads for the Specialty Medical Guidance Program. First thing is, Specialty Medical Guidance Program refers to authorizations that we stated for related to both cancer and especially non-cancer conditions. This demonstration will focus on the cancer-related request and how those can be authorized through our MBM Now platform. First thing to note is that this program was developed in close coordination with providers, and making sure we can provide an easy, streamlined authorization process is very important to our overall program. We've developed this with insights from a team of oncology clinicians, including 10 board-certified oncologists, specialty pharmacists, registered nurses, to make sure that it is as streamlined and clinically accurate as possible. This program is used to support authorizations for 24 million plus members. We take all those insights into how we design the program in MBM Now. And we have pretty significant experience doing in specialty drug management, where we're trying to engage with providers in a streamlined way as possible. A few of the highlights for how this program works. First is the MBM Now website can be accessed for those that have access to My Insurance Manager by there. So you go to My Insurance Manager, you can choose a drug that would be in scope for the program, and then that would single sign you on to MBM Now. Most of the authorizations take less than 10 minutes, and that's in part because a large majority of the requests that come through end up being automatically approved, meaning the provider is choosing something that is in alignment with policies that are put forth by Blue Cross. For cancer, the guidelines that we are putting forward in MBM Now are based on NCCN guidelines, National Comprehensive Cancer Network. That's really the gold standard for evidence-based care in cancer. There's been a lot of interest in the ability that we have for MBM Now to approve drugs on the medical benefit, but also pharmacy benefit for OptumRx members, and particularly oral and topical chemotherapy. That can be quite helpful because there are chemotherapy regimens that are a mix of IV or injectable and oral drugs. We encourage providers to go to MBM Now to get the whole regimen authorized. You don't need to go to two separate websites for two separate reviewers. We also want to call out that providers have expressed interest in our clone auth functionality, which basically means if there's authorization already submitted and approved for a given member and a provider needs to do a new authorization for that member, but only leveraging a few changes in it, they can clone the old authorization, make the changes, hit submit. It's a way to expedite the authorization process. Okay, let's go through to walk through some of the screenshots. So the first page that the provider will go to after single signing on from MIM would be our provider dashboard. So they'll be able to see any authorization requests that have been submitted associated with a given member, the status of those, as well as any draft authorization requests that have been started and not yet finished. The provider, if they want to start an authorization, can then go to the member search page. We ask for last name, date of birth, and subscriber member ID to make sure that the member is in fact eligible and they do require prior auth. Let's assume in this case that we have the right individual here. We would then ask the provider to choose an authorization type. So for cancer, there's probably two ones that will be used most frequently. So outpatient chemotherapy, that's if the provider is looking to use a chemotherapy or anti-cancer regimen, a set of drugs. We can also authorize for supportive drugs only. Those would be for white blood cell growth factors, bone density drugs like Prolia and Xgeva, hormonal agents that are often used in combination with chemotherapy, perhaps at the same time or a few days or weeks afterward. Also worth noting, the specialty pharmacy authorization type would be used for if you're looking to get a specialty non-cancer authorization done So again, the point being here, it's all one website to be able to get cancer and non-cancer authorized. Just choose the right authorization type. We'll then go to assume that we chose outpatient chemotherapy here. And we would then move to the requesting provider page. This is where we just ask the provider to input information about both the requesting physician and also the point of contact or the person that's entering the authorization on behalf of that physician, in case we need to get some more information about or to clarify an aspect of the request. We can then ask about the servicing provider, which for most cases will be the same as the requesting provider. If it isn't, we would have an opportunity for the provider to amend that and looking up based on either TIN or NPI at a physician basis or the facility. Provider would then move to the request details page. This is where we're asking about some of the clinical details associated with the patient so that we can learn which patient-specific questions we should ask. Just to call out a few here, we do require an ICD-10 code, and this would be, there's about 1,300 ICD-10 codes associated with cancer. We would need to make sure one of those is chosen so that we are not reviewing a cancer drug request for a non-cancer diagnosis. And then in the primary cancer field, this is where the provider is going to choose one of about 62 different cancers that are NCCN provides guidance on. And in this case, if we chose breast cancer, we would get on the next page breast cancer specific questions. Okay. So in this case, it's just an example. There are 7 questions here that need to be asked for breast cancer. The types of questions will differ if it's colon cancer or prostate cancer. The type of choices available to those questions will differ as well. And these are all based on, again, NCCN's content. We have a team of pharmacists that are working with NCCN on a daily basis to determine what's the latest evidence and what would be the questions and the answers that we would need to be able to build into here. NCCN then validates those rules before we publish them. So in this case, let's say that the provider was looking for an auth for a stage 2 adjuvant, HER2 negative, ERPR negative, so on and so forth type of patient. We would then show the regimens that are clinically appropriate for that patient. So simply noted, here's the set of regimens. Sometimes it's 2 or 3, sometimes it's 30 or 40, sometimes it may be 0 if it's the case that for that set of choices, chemotherapy actually isn't indicated. But in this case, these would be regimens that if the provider would choose them, they're in alignment with evidence for NCCN, they would be available for an auto approval within the platform. So to give a bit more detail on each of the different regimens, the provider can click the arrow and then see what are the drugs that are automatically approved, or the drugs that are included within that regimen. This would be Capox, for example, with capecitabine, oxaliplatin. And we would be showing here the drugs that are on Blue Cross's prior auth list, right? So if there's a drug that does not require prior auth, it would not be shown here because we're not authorizing it. But this would help clarify for the provider. The other thing just to note is that we do provide the standard of care dosage and administration information here. Authorization decisions are not based on appropriateness of dosage. We obviously encourage providers to follow that, but at this time, if the providers are to use a slightly different dosage from what would be listed here, they would not need to submit a custom request. They would be able to choose this regimen for that. So in this case, like I mentioned, if one of those regimens was chosen, there would be an auto approval. The provider would get to this screen with the authorization number, along with the authorization start date and end date. So let's say that the provider was looking at that list of regimens and did not find a regimen that they are looking to be able to get authorized or of the options that would be available for approval. They tried those and there's toxicity concerns. The provider could choose create custom regimen. They would then get to the page where they would add in specific drugs that they need to get authorized for, drug A, B, and C. They would then need to provide a regimen justification for why they're doing a custom request and add clinical documentation to help support it. Just one note is that if it needs to be considered as an urgent request, which would be according to regulatory standards, reviewed within the definition of an urgent request timeline, the provider can flag that. They would then need to call into our authorization team to note that it's urgent request so that we can make sure we are reviewing it according to the appropriate turnaround times. This is an example of the screen to add in the type of drugs that would be requested. Okay, the provider would then get a request summary page just to make sure that everything they entered in was accurate. They can edit it at any point back into the tool. And then there would be the page that basically says the request was not approved, it's pending. Here's the pending number, and our clinical team would then be reaching out to see if there's any additional information we need to review the request, and would be in touch with the provider. Okay, I mentioned again about that clone authorization functionality. So that would be available next to any submitted auth on the dashboard. Provider can choose a clone request, and then they can choose how exactly they want to be able to make the modifications. They would then be able to edit any questions that were previously completed and click submit. So that helps expedite completion of an auth. Okay, so we walked through the process for getting an outpatient chemo authorized. However, this would then be the process to get a supportive drug authorized. It's similar to especially non-cancer, where in this case, the provider would be able to pick what is the type of drug that they're looking to get authorized, and then we would ask questions particular to that type of drug. We do it in the reverse order for cancer drugs, in part because there's so many new drugs that are coming out for cancer with new indications. We've designed the tool in a way to say, provide the clinical information about the member, and we'll let you know what the latest evidence is and the latest treatments are that would be available for that type, so the provider is aware of all the options. Okay, so in this case, if we were to choose a white blood cell growth factor, there would be questions specific to that to see which type of white blood cell growth factors may be appropriate. And then we would list out options, again, that are on the prior auth list for Blue Cross that would be made available. For any of the long-acting type of white blood cell growth factors, in this case, we would ask about a question about if the chemo regimen is scheduled for every 14 days or greater, just to make sure that would be appropriate. One other component we want to bring up is the member search capability. So on the dashboard, provider can choose search, and that would allow them to look at, for example, any submitted authorization requests that they have submitted under their tax identification number to see the status of those, or drafts. We do list the top 10 submitted in drafts on the dashboard, but if there's more than 10 the provider has, they can look up those. In addition, on the history tab, we would have available for requests that were entered on the previous vendor's platform. If that still applies, we've loaded in them in here so that the provider will be able to see. Okay, that's everything we have today. So again, Tim Foley from Optum's Specialty Medical Guidance Program with our MBM Now platform. Thank you for listening.